Moving to health news now, childhood lead poisoning is one of the biggest health issues facing the city of Cleveland because so many homes still have chipping lead-based paint on them. Despite the city's efforts, not much change has been seen. Senior health correspondent Monica Robbins sat down with the Cleveland Department of Public Health Director to get some answers.
Thank you. Joining me now is the director of the Cleveland Department of Public Health, Dr. David Margolius, to talk about a subject the city of Cleveland and our region has been fighting for decades: childhood lead poisoning. Thank you so much for being here.
My pleasure. Thank you.
All right. CDPH released a report last October. Do we still have one of the highest levels of childhood lead poisoning in the United States?
Sadly, Monica, it's not only one of the highest, it's the highest in the country. It is 2 to 3 times higher than Flint, Michigan ever was in the city of Cleveland.
So why is that? We've been fighting it for years.
Yeah. There's still so much lead-based paint in our homes in Cleveland. That's where lead poisoning comes from. Actually, it's the #1 cause in the country, despite all the attention the water gets. And in Cleveland, when you drive around our neighborhoods, you just see a lot of old homes that haven't had the same type of investment as homes in the suburbs.
Well, 6 years ago, the Lead Safe Coalition was formed, and it raised, with philanthropy, $100 million to address this program and this problem. So what's being done with that money?
Yeah, well, I think we all acknowledge that not enough has been done with that money to get into homes. The way that we get out of lead poisoning in Cleveland is to build as many new homes as possible, tear down as many old homes as possible, and then fix homes that can be fixed. And so we really are working closely hand in hand with the coalition to get the money into homes so that there are less old wood windows, less old wood porches, and everything else that can chip and cause lead poisoning in babies.
But what about testing these homes? Like, we have so many landlords, and we have a lot of landlords that don't even live in Cleveland. How are you addressing that?
It's difficult. I think, initially when the law was passed in 2019 in Cleveland, the focus was on forcing the landlords to test their homes and the ones who weren't, taking them to court. And we probably could do more enforcement, but we've got about 80 landlords in court right now, and some of them live in California or Turkey, and they just don't show up. And so we've got to do better at finding willing property owners, fixing their homes so that fewer and fewer kids come home to a house full of lead paint.
When you say enforcement, what is the penalty?
So it depends. It can be, you can get, some of the charges have been up to $100,000 that landlords are being faced with. There's also these civil tickets that we do that are just like $200. So it's kind of varying levels of enforcement. We're trying to try all these different things to see what works.
But you're talking about a house that is a health hazard.
Yes.
For a child.
Yes.
Is there a possibility of these people losing these homes?
The landlords, absolutely. So a number of properties have gone into foreclosure and receivership and all sorts of other things. But then you've got a family who's essentially being evicted. Right. And so it is complicated. There's no one person who carries the blame, but we are going to be the first health department in recent history that will help us start to reduce the lead poisoning cases once again.
All right, where are we on testing? Because that's one of the big things we need to do is test our kids.
Right. So in 2019, there were 11,000 children under the age of 6 who got a test. During COVID, it was 7,000, 8,000. And then this past year, it was 8,200, which was up from 7,800, but nowhere near the 11,000 that we did in 2019. So there are too many children out there right now who are not connected to a pediatrician and aren't going in for those routine visits to get a test.
So how do we get the testing back up? And what was the reason for that, not connected to a pediatrician?
During the pandemic, we lost a number of families to our systems. We broke their trust, and so there are children who have been missing their vaccines, who have been missing their wellness visits, and so we're hitting the streets to re-engage families with our health systems, with our federally qualified health centers like Neighborhood Family Practice and Care Alliance, and just trying to get reconnected so that we can earn the trust back of the community so that they're getting their routine health stuff.
And coming up in the next hour, Monica continues her interview with Dr. Margolis about the health dangers lead poses to kids and the resources the city has for parents and residents that are just a phone call away.